discussion on somatoform disorders. First, let me just sort of send out a few messages to let people know that I'm here. Now, let me give a few minutes to give people a chance to come on in. Hope things are going okay today. We're going to go through somatoform disorders. I was going to send somebody a link, but I forgot who I was sending the link to. Really bad at it. Okay. Good, guys. Today we're going to have a very interesting discussion on somatoform disorders. Somatoform disorders. What are somatoform disorders? Let's get it in, buddy. Let's get it in. Let's see here. Let me just go to Google and just explain. Explain the assessment and treatment of somatoform disorders. These are complicated. These disorders are kind of complicated because the symptom clusters fall everywhere. The patients have an unusual combination of different symptoms, you know. But let me see if I can make this make some sense for you. Assessment of somatoform disorders involve ruling out organic medical causes for symptoms. Before I move to assessment, let me change. They're jumping too far into the story. Explain. I didn't want it to sort all the way to the assessment part. Let me at least give some description. Here, a somatoform disorder, now largely known as somatic symptom disorder, is a mental health condition characterized by one or more distressing physical symptoms, accompanied by excessive thoughts, feelings, or behaviors related to those symptoms. So, for example, someone can feel that they have a stomach pain or discomfort, right? And it's there nagging at them, right? And they can become excessively preoccupied with it to the point where it seems like they're excessively focused on this sensation to the extent of everything else around them. When they're pulled back into the discomfort and away from other things, then you'll see how that pain or discomfort has sort of like a magnetic pull. It pulls their attention and they continue to focus excessively on that pain and discomfort. The symptoms themselves are real, right? See, that's the key here. The symptoms are real. It's not imaginary, right? but they are often disproportionate to the underlying medical condition, or a medical condition cannot be found, right? This is very complicated. So people come in with pain, but then um, you can't find a explanation of it, or they no longer have the medical condition, but they still have the pain associated with the medical condition. Yeah. Um, it creates a functional impairment because these symptoms and their health concerns. Functional impairment, they can't function at work. They have difficulty functioning in interpersonal relationships. Have a lot of difficulty functioning. Key characteristics of somatic symptom disorder. Physical symptoms. The individual experiences a real physical symptom such as pain, weakness, or shortness of breath. The key is that the pain and discomfort is real. They're not lying, right? It causes distress and dysfunction. The symptoms cause significant emotional distress and interfere with daily life, right? Excessive thoughts and feelings and behaviors. The person has excessive thoughts about the seriousness of their symptoms, high energy level, high levels of anxiety about their health, and spend excessive time and energy on health concerns, right? Yeah, this is a significant part of that. These symptoms these symptoms may or may not be medically explained. The physical symptoms may or may not be associated with a diagnosed medical condition, but the person's reaction to them is the main prime problem, right? Not faking. The person is not intentionally faking their symptoms. The pain and other symptoms are genuine. So remember, in somatoform and malingering, there is a benefit, right? So the benefit is they want to stay in the hospital, right? So they can produce pain that sounds like this. In that situation of malingering, they're lying, right? um, I'm doing a series on narcissists and trying to help people understand that when there's sick narcissist in front of you, that's a clown, and you're actually dealing with a whole network of idiots. So when you're dealing with a narcissist, when they target you, they play the victim role. And oh my God, they come up with pain everywhere. Ooh, ooh, ooh. When the narcissist plays the victim, boy, I mean, they fake pain everywhere. And it's all dramatic. It sort of pulls you into their suffering as they develop the victim narrative of how much they've been victimized and things like that. Um, so narcissists and like people who malingering, they're lying, but not somatoform. These are real. What is no longer used to describe this condition? Yeah, historically, terms like somatoform disorder were used, but the terms has been updated to somatic symptom disorder. Yeah, 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 somatic symptom disorder. You're going to see some of the nomenclature sort of change and updates as we learn more about these disorders. This somatic symptom disorder makes it, the label suggests that these are real symptoms, not a form of a disorder, but a real disorder. The name sort of suggested malingering, right? Specific previous conditions like somatization disorder, undifferentiated somatoform, hypochondritis, and pain disorder now incorporated under a new umbrella of somatic symptom disorder. They put all these. I did go back and look at the podcast I did on pain, primary pain disorders. These are something else too to treat. That pain is real too. So look, I'm gonna go back and update. I have to go back and update my titles. Let me see here. Let's see if I can do it now. Okay, somatic symptom disorder. I just updated it. Yep, somatic symptom disorder. Okay, let me see where I'm at now. Okay. Oh, potential causes: difficulty processing emotions or a tendency towards negative thinking patterns. Now, it just so happens that You know, one of the primitive defense mechanisms is somatization. Let me see. Defense mechanisms is how your ego defends itself against things that's threatening them, how your ego responds and interprets things. And one of the primitive defense mechanisms, I believe, is called the somatization. Let me see if it's self-asserted. Okay, mature defenses, neurotic defenses, immature defensive. Okay, look, immature defenses here, immature, depressive, passive aggressive, help rejecting, complaining, acting out, splitting, projection. I was looking for the defense mechanisms that would possibly have the person, make the person susceptible to the somatoform type disorders. Somatoform, I gotta get the name right, to a somatoform disorder, but I couldn't find it. So here, um, so potential cause is difficulty processing emotions. And so what happens is that people who use primitive defense mechanisms typically um, um, suppress their most intense and difficult urges and things like that. All the things that people cannot handle, they have a tendency with the primitive defense mechanism to suppress them out and repress them to outside of existence. Now, because they're not consciously aware of these issues, or they can't consciously deal with the trauma or the hurt, the pain, the rejections, the stab in the back, then they repress it, but it comes up as physical pain and discomfort, right? So someone who's been sexually abused may have GI or urinary symptoms or GI symptoms that represent sort of like the discomfort and the trauma of what you experience. And so, not being developed healthy or not maturing enough and having the appropriate defense mechanisms, then it's more like a setup to be having a somatoform type disorder, because it's hard for you to process things. And so people process things, they feel it in their body. So these things are real. A tendency toward negative defending patterns. Really, the primitive defense mechanisms are black and white, either all good or all bad. Here we are right there. Environmental factors such as childhood trauma, abuse, neglect, being around sick people. Now, look, these people with somatoform disorders, if they are around sick people such as narcissists, psychopaths, and sociopaths, they accentuate the pain. They create so much chaos around them with targeting them, with attacking them through third parties, with starting reputations. Can you imagine somatoform, someone with a somatoform power disorder being around or being attacked by a bunch of group of narcissists? Yeah, and see, look, the environmental factors, usually there's a childhood or surrounded by people who devalue them. They're surrounded by people who spread rumors about them, all these things. It's a tremendous amount of psychological and emotional abuse associated with patients experiencing these things. Cultural attitudes towards physical symptoms and medical care. What do you do if you suspect it? Okay, yeah, seek medical care. Okay, so this is what we're talking about here. Somatic symptom disorder. I have to remember that. If I'm going to teach it, I got to remember the name. Okay, now here's the one on the assessments. And let me know if you have any questions. Let me know. You can just type them down in the chat section. But here, let me go through the assessment. See, the assessment for somatic symptom disorder involves ruling out organic medical causes, right? Both psychiatric, right? Remember the psychological, emotional abuse, trauma, reacting to emotional, psychological abuse, and medical histories, and performing physical and mental status exams, right? The physical exam look for the medical problems, right? Mental status examination, you're going to know whether the person has a delirium, a psychosis, or mania. And this you're going to pick up from the mental status examination. Treatment focuses on daily functioning and coping skills using regular supportive visits with a primary care physician to build trust. The person likely doesn't have trust outside of their home. right? So that's why being a physician is very important, because your role is to trust your patient, right? Right, and this is where they get the trust from. Effective treatment includes psychotherapy, right? Because you're gonna need some help getting. You're gonna have to identify all those sick people around you. I'm not sure if you can get better if you're surrounded by sick people. That's why narcissists always have to go to people around you and talk about you behind your back, right? Narcissists are trying, psychopaths and sociopaths are trying to create a community against you. That's why they always have to say things in secret and hide. These creeps, they're awful. Cognitive behavioral therapy to manage thoughts about health and symptoms. Um, okay, assessment. Rule out organic causes, right? Gather medical and psychiatric history, right? This is most important. Build a therapeutic alliance. Establishing trust and empathy with the patient is crucial. Acknowledging their discomfort, and validating their symptoms. In the pain, the discomfort in a somatoform disorder will likely have two components. One, it'll likely be the physical pain from the underlying condition. And then, number one, the psychological pain or discomfort associated with it. And many times, the psychological component inflames to the point where it becomes the predominant symptoms. The depression, the anxiety, the insomnia, the fits of mania, the fits of rage, the psychoticism, all of those can be the result of the psychological component not being managed as well. That's why it's important that we do a mental status examination and start to look at other areas, to look for other areas that may not be functioning as well. And those are the areas where we can sort of design our treatments. So we have to look at the person's attention and concentration. If they can't pay attention or concentrate, we have to give them something to support their cognitive functioning. If they're very depressed, we have to support the depression. If they're manic, if psychotic, we have to support psychoticism. So you're going to have to build that therapeutic alliance, right? So they can validate their symptoms and then help try to identify all the different areas they're having difficulty in and start addressing those areas, right? So that's when your multidisciplinary treatment team comes up. That's when your psychologist, your therapist, all of these other treatment team, social worker, all these other treatment team members come to help with this. Screening. Specific screening tools can help you determine the presence of a somatic symptom disorder. Let me just see screening tools. Okay, they just said it. They don't offer anyone. If someone knows a screening tool, let me know. Treatment, regular supportive care, psychotherapy, psychopharmacological approaches, avoid narcotics. This is going to be this is endurance here, lifestyle intervention. I would encourage anyone I'm not sure what's more damaging to you, a riot outside or having to work next to a narcissist. I think if you're working next to a narcissist, you're going to need some type of lifestyle intervention. If you're living or working next to one of these sick people, I think you're going to have a hard time. So lifestyle interventions is something called the geographic cure. You simply leave and you never walk back. You never look back. If you leave and your pain goes away, listen, the longer I practice psychiatry, the longer I start to know it's the people around you. Oh no, it's the enemy is not far. It's the people around you. And these narcissists, psychopaths, and sociopaths, they specialize in trying to be your friend, and they create all the internal turmoil that causes you emotional, psychological pain. So here, it's hard for me when I look through patients with somatoform disorders littered with narcissists around them. Mom was a narcissist, dad's a sociopath, all of this. Focus on functional goals. The functional goals are the only way you're going to help these people out of this, right? You're going to have to count the numbers. I mean, how many times you worked out this week? Got to work out once a day. How many times you avoided sweets and things like that? How many times you're fasting, or how many times you go into church and get into your routine? Yeah, these things, the goals that they have to set. Make sure you go to church every Sunday. No, you're going to have to be the first one there inside the chapel or the mosque or wherever you pray at. You have to be the first one in there, right? Functional goals like that. things like hygiene. You're going to have the best hygiene. I mean, every day you're going to have the best hygiene. Focus on goals like that. That'll help them build their lives and get the motivation to get out of there. Patient education, helping people understand the origin of the pain and the discomfort and things and what does it mean. It could be a flashback, right? It could be like post-traumatic stress disorder flashback. It could be something like that, you know. Yeah, number of things. So, hey, let me give you a question. Hey, Muhammad, how's it going, buddy? Thanks for your question, bro. Let me see here. Can cognitive behavioral therapy truly help these patients? Yes, right. Let me see. Cognitive is what you think. Behavioral is how you behave. That's what I said. Behave. Walk away. Cognitive. Never think about it again. Solves every problem. Me. I'm not the type of man that fight. I'm the type of man that run. You don't have to win every fight. You only have to win the last one. I'd rather win the last fight and better run. Right. So CBT is very helpful because the cognitive pieces help you detach from the things that you're attached to. Right. And the behavior things help you behave differently and mainly use that behavior to not go there again. That's it. I think that's all that I have for today. It's been a pleasure talking to you guys. Somatoform. So remember this. Let me make sure I have it right. Should I have it right? Okay, yeah, somatic symptom disorder, treatment and assessment. And basically, you're going to treat whatever you have. If it's mood disorders, use mood disorders, anxiety, SSRI, psychosis. You know the spiel. Read out. Take care, guys. Check it out. Ciao.